Now we're going to look at the devices side by side, and I'm going to do a nice comparison for you of all the pros, cons, and costs of all the devices. I have no conflict of interest. Now, for the absolute beginner, the choices can be just overwhelming as far as what types of punches to buy, the different devices out there. The punches can be blunt, sharp, a combination thereof, different devices. We have manual, motorized, even robotic. And then some may ask, can we combine devices and punches? And we'll look into that as well. Now, there are many different circumstances why one would decide to use one device over the other. As you move through the field and learn more about different grafts, you'll see that some are longer and coarser. There's curl. Some of these require different devices. Also, there's many different skin types in patients. You'll see tight, elastic, soft or boggy tissue types, and some of them just plain old respond better to one device or the other. Also, the area of the donor is very important, as even in the same patient you may find that the area of the changes quite dramatically. Special circumstances exist as well. Some patients may have large FUE grafts that need to be removed. Also, beard and body hair sometimes just respond better and are easier to extract with certain devices. Now, why is it important to choose the right device? The answer is quite obvious. You want what's best for your patient. You want the lowest transection possible. You want to minimize lost or buried grafts. And while you're at it, you want a device that's easy to use. You want something that's very good for beginners, something that you can pick up and learn to become an expert very quickly. And as you do so, you want to also look at the cost of ownership. Over time, you want to make sure that the cost of ownership is good. Now I'm going to go over a few of the devices here and go over the pros and cons of each of them. First of all, the blunt punch with the motorized device is great for beginners. It comes with low transection rate, good with long curly hairs. Some of the cons, though, we've seen with soft or boggy tissue, there may be a challenge using this device. Also, it has a tough time with acute angles or boggy areas, beard or body hair areas. Also, there may be more buried grafts with this device. The cost of entry is not too bad. The manual device with the sharp punch is a great device for the great majority of tissue types. It tends to give you a very nice feel using this manual punch, more so than motorized. The cost is also very low to get started. Some of the cons, though, with the manual is that it takes quite a bit of experience to become very proficient with its use. You may find higher transection rates than with the blunt device, especially with the smaller punch size. You may find more difficulty with longer hair or curly hair, and also, as I mentioned, there may be some more fatigue in the newer user. The cost is very low. The motorized device with the sharp punch picks up with some of the same pros as in the manual. It's great with the majority of tissue types. The cons, again, the same with the higher transection rate and using the smaller punch. Also, another pro for the motorized device is there's less operator fatigue, so this would probably be a better device for a beginner. Although the sharp punch device, I think, personally requires a little bit more experience than does the blunt device or some of the other hybrid devices we'll see shortly. The cost here can range anywhere from $1,600 from a simple handheld unit here in the center to a PCID, which can run upwards of $25,000. The FUE device is one of the newer devices with a hybrid punch. The pros here, it's great with the majority of tissue types, great in a majority of areas of the scalp. Also good with long hair, beard extractions. The transection rate tends to be fairly low, and beginners can pick this device up fairly rapidly. Some of the cons, certain tissue types may be a little bit more challenging, and also the initial costs are much higher than some of the other devices we mentioned. One of the newest hybrid devices here is the Multiphasic Device. Now, it's also very good for all tissue types. It has a very nice fully adjustable setting, which is good for beginners to set for the tissue types. Also, long hair FUE is possible, which is nice. Some of the cost here, can be much higher than other devices, which is a con. Also, in my experience, there's a little more maintenance with this device because there's more parts that can malfunction than some of the other devices. The costs there below you can see are also at the upper end. I'm going to go through a few patient examples to give you an idea of what devices may or may not be helpful for certain patient types. Here's a 45-year-old male here for his third FUE procedure. He just wants more density in the mid-scalp and vertex. His goals are to use whatever donor is available still in the scalp and the beard. The patient has long, straight grafts. There's some change in direction in the FUEs because of prior history of hair transplants and scar tissue in the donor area. Some of the devices to be used, I would say pretty much all the devices we mentioned would be great to get started for this patient because of the long, straight grafts. I think that you should have really little problem using any of these devices. The FUE and the multiphasic would probably be the easiest, along with the blunt motorized for a beginner to jump into and get some good quality grafts in this patient. The same patient though also wants some beard extractions. Now as you can see through the right there's a nice curl there in the beard. This is a little bit more challenging with blunt motorized to obtain. Also under the beard is a tough area to use that blunt device. The sharp may be more difficult with that curl as well. The FUE and the multiphasic are probably the best bets to go and attempt to get these grafts. The second patient example here is a 60-year-old male undergoing hair transplant for his hairline. As you can see, some larger, coarse grafts in the front that he wants to soften. The blunt motorized may be possible, as well as the manual sharp for this because of the change in direction. But I would probably start off more with the FUE. In my hands, I think it's great with the change in direction and the larger grafts using a smaller punch size. Multiphasic may also be used. Some thoughts and pearls here. Beginners should really try to start with using more than one device as soon as they can. I think it's a great idea to have more things at your hands to use to combine with the same patient if needed as well. Also, if one device doesn't work, you have a backup to get into. Always be mindful of minimizing transections and maintaining the donor for the future. And you should really try to do your best to become an expert in your devices to know the extent that each of the devices can go and to know your limits. Thank you very much for your time.